Good morning. On behalf of the IIP Digital team, I, Dr. Manisha Talpalikar, welcome you all for today's session. To celebrate Women's Day, the IIPWC of West Bengal have organized today's event. The topic is Awareness of Cervical Cancer in Young Females. Our speaker is Dr. Varsha Saboo, who is an obstetrician, gynecologist, and a laparoscopic surgeon. The moderators for today's session would be Dr. Sonali Sengupta and Dr. Priyanka Sharma. We are live streaming on the official IAP India YouTube channel. I request all the participants to kindly subscribe to the IAP channel and you can receive regular updates and attend other upcoming webinars. If the participants have any questions, please write them in the chat box. These will be answered at the end of the webinar. I now request Dr. Sonali to kindly take over. Thank you.
Sure, ma'am. Thank you, ma'am. Very good morning to one and all. I, Dr. Sonali Sengupta, Sub-Coordinator, West Bengal Branch Women's Cell. Welcome all on behalf of IIP West Bengal for this interesting, informative session on awareness of cervical cancer in young females. I want to extend my sincere thanks to our IIP President, Dr. Sanjeev Jha, and IIP Women's Cell Head, Ruchi Vashne, to CEC team and all members and our dear participants. Thank you all for coming, and I hope you will enjoy the session. And now I would like to take the opportunity to introduce our speaker, Dr. Varsha Saboo. She is at present working at ILS Hospital, and she's got a stint in gynecology surgeries, laparoscopy surgery, and obstetrician. Also, she is, and she's in this practice for 14 years. And she's a very good surgeon, very beautiful lady, and very good at heart also. I like how much I came to know about her, and she's a wonderful lady, and her surgery is also she's got a very expert hand on it, and we are eager to hear from her, right? So over to you, ma'am. Please come on to the call, Dr. Varsha Saboo, ma'am.
Good morning, everyone. Thank you, Dr. Sonali, for such a warm introduction.
Thank you.
Thank you, IAP Women's Cell West Bengal, for inviting me on this auspicious day. And having me here to have a talk with everyone about awareness of cervical cancer in the women. It's a very important topic and the need of the hour that women know about this deadly disease, and they take the primary and the tiny steps in preventing the disease. I express my heartfelt thanks to Dr. Sanjeev Jha, the IAP President, Dr. Ruchi Vashne, IAP WC National Head, Dr. Smita Singh, IAP WC East Zone Head, Dr. Anandita Biswas, the State Coordinator, Dr. Priyanka Sharma, State Joint Coordinator, and Dr. Sonali Sengupta, State Sub-Coordinator. So, we all are here to have a discussion on awareness of cervical cancer in women. Am I audible to all?
Yes, ma'am.
Yes, ma'am. So, we all know that women are the pillars of our society and the driving force of all the foundation, and they work very hard and to take care of everyone, to balance everything. But in doing all this, we often forget to take care of our own health. And so this is very important that now we start taking care of our health, because only a healthy woman can take care of the society and can build up a healthy nation. So awareness of cervical cancer, prevention and screening. So when we talk about taking care of our own health, and we mean that we can diagnose and we can find out the symptoms of the diseases at an early stage, and maybe even before they go into the they develop into the disease by some primary symptoms, so that we can better prevent the disease from occurring in the first place. So when we talk about these diseases, cervical cancer is one of those diseases which is very deadly, but at the same time, it is preventable if the steps are taken at the right time. So before going into what is cervical cancer, we will just brush up our basic knowledge about what is cervix. So the cervix is the opening between the uterus, that is the womb, and the vagina. If you can follow the pointer, this area is known as the cervix. This is the uterus or the womb. This is the vagina, and the junction of the two, or the opening of the uterus into the vagina, is known as the cervix. And this cervix is lined by two types of epithelial cells, the squamous cells and the glandular cells. And the junction where these two meet is known as the transformation zone. So the area inside the uterus, the area of the cervix inside the uterus is lined by the columnar cells, and the area of the cervix around the vagina, this area is lined by the squamous cells. And the junction is the transformation zone. So why is this important? The transformation zone is important because the cervical cancer and the precancerous changes tend to occur at this transformation zone. Talking about cervical cancer, why it is so important to have a knowledge of this, because this is the second most common malignancy among the women globally. And unfortunately, India alone accounts for 1/4 of the global cervical cancer burden. So if we look at the magnitude, while India makes only 16% of the world's population, it alone shares 27% of the world's total cervical cancer cases and deaths every year. So there is a huge burden of the disease on the society and on the healthcare system. So that is why we need to have a screening protocol in place to screen the cervical cancer. And why this is so important? Because this large-scale morbidity and mortality is unwarranted, as the disease develops really very slowly after the initial infection with the HPV. It can take up to decades for a person to get an HIV infection, and for this infection to go into the stage of cancer through various precancerous stages. So we have got a really long time where we can diagnose the disease, where we can diagnose the infection, rather we can diagnose the infection and can cure it, so that the disease itself gets settled then and there. And unlike most of the cancers, it is preventable when the precursor lesions are detected and treated in time. So while talking about the cause of cervical cancer, nearly all cervical cancers are caused by an infection with certain types of human papilloma viruses, also known as the HPV. So infection with HPV is the primary cause of cervical cancer, as much as up to 90% of the intraepithelial neoplasia, that is a precancerous stage, attributes to HPV infection. Interestingly, there are more than 120 different types of HPV viruses identified, out of which 30 types primarily infect squamous epithelium of men and women. So if we talk about the incidence or the prevalence of HPV infection, how common it is very common, so much so that 4 out of every 5 people will have HPV infection at some point in their lives. Both men and women can get HPV infection, and one can get the infection even in the very first sexual exposure. So yes, HPV is a sexually transmitted infection, and one can get infected even during their first sexual exposure. More than 75% of the sexually active women have been exposed to HPV by the age of 18 to 22 years. So that is a very young age, and that is why young females need to know about this disease, need to know what they can do to prevent this infection from acquiring this infection. And also the mothers of these young women need to know, and they should provide knowledge and information to their daughters, so that they can get prevention from this disease at the right time. So looking at the incidence, this is a very common infection, so one might get worried. But the good thing is that usually HPV infections do not persist. Those, and even if those infections which persist, they can remain latent for many years. And there are different types of HPV viruses which can infect the cervix, vagina, and the vulva. There are certain low risk types like 6 and 11, which can cause genital warts, and there are certain high risk serotypes of HPV like HPV 16 and 18, which we will know in the slides to follow. That these high risk types can cause precancer and cancer of the cervix, which usually takes many years if they are not treated in time. Any factor that influences the integration of HPV DNA into the human genome may cause the progression to invasive disease. So looking at this, one might get worried that if this infection is so common, and if I have this infection, does that mean I'm going to get cancer? No, it's a big no, because fortunately, most women who are infected with human papilloma virus will never have any symptoms. And in most cases, HPV infection will go away naturally. Only women who have persistent HPV infection, the term we use where the virus stays inside the woman's body, that is, the virus does not go away naturally, are at risk of cervical cancer. There are certain groups of women who are at increased risk of infection. Although any women who have ever had sex can acquire this infection, but the women who have had more than one sexual partner, women whose partners have had more than one sexual partners, or the women who have had any other sexually transmitted disease are at increased risk. So as we have discussed, this HPV is a sexually transmitted disease. So all these factors increases the risk of sexually transmitted infections, and HPV is being one of them. There is a higher risk of HPV infection in this subset of women. Also, the women who do not have Pap test or the cytology or the cervical screening test are at increased risk of cervical cancer, because the opportunity of detecting the disease at a pre-cancerous stage is missed, and the disease progresses to the cancerous stage, and many a times to the incurable stage also. Women with immune problems, including those who use steroid medications on regular basis for whatever reasons it may be, women who have had an organ transplant, who are undergoing chemotherapy, or who are infected with HIV, these set of women are having a compromised immune system, and so these are more prone to get infection. And another one very important risk factor is smoking, and smoking itself increases the risk of HPV infection and cervical precancer lesion, and doubles the risk of getting cervical cancer. So the next question which comes into the mind naturally is how one can lower their risk of developing cervical cancer. So there is no short way by which we can prevent this the incidence of this cancer, but there are certain behavioral changes which we can do or take to decrease the risk, like delaying the onset of sexual activity, knowing the status of your sexual partner, quitting the smoking, maintaining a healthy diet and a healthy lifestyle, practicing safe sex practices using condoms, because they increase the risk of transmission of all sexually transmitted infection, including the HPV infection. And if eligible, one should consider getting the vaccine, which prevents most cervical cancers, and getting the Pap test and the HPV testing done as recommended by your healthcare provider. So what we have gathered, what information which we have gathered till now is that most important things which we can do to prevent cervical cancer is to get vaccinated against HPV in time, and to have regular screening tests and go back to the doctor if the screening test results are not normal. I would like to ask all the beautiful ladies out here that do you have any knowledge about cervical screening, or rather I would like to put up the question, have any one of you undergone any test for cervical cancer screening till now?
No, ma'am.
Anyone else? Anyone has undergone cervical cancer screening
No.
till now?
No,
No,
ma'am,
ma'am.
no.
So this is the problem. Even being the healthcare professionals, we lack the adequate knowledge and information and what to do and what not to do to prevent ourselves from the cervical cancer. So this is very important, and it's really the need of the hour to spread this knowledge to all the healthcare professionals, which in turn can spread the knowledge to all the people they come across with, and also they can protect their own life. So what is the recommendations of cervical cancer screening? So WHO recommends every woman in the particular age group to be screened through universal screening. Now there are different methods of screening, like the cytology, which can be done by the conventional Pap smear method or the liquid-based cytology. There is another test called HPV DNA testing, which is currently the primary test of screening according to the recommendations. And the third one, which is not recommended nowadays, is the visual approach, where we visually inspect the cervix after applying some solutions like VILI, visual inspection after Lewis iodine, or VIA, visual inspection after acetic acid. And after applying these solution, we see a changes in the affected area, and there is a contrast between the normal and the abnormal looking cervix, and we can get an idea. And if there is a change we notice after application of this solution, we can go for further testing. So here comes the confusion. There is a great disagreements and recent changes in the strategy of about whom to screen, when to screen, and what screening test to use for cervical cancer screening. Earlier, WHO used to recommend that before 25 years of age, no screening is required. From 25 to 49 years of age, every woman should be screened every 3 yearly by cytology. From 50 to 65 years of age, screening should be done every 5 yearly by cytology, and more than 65 years, screening is not necessary if the last 2 smears were negative. But there is a recent change in the WHO recommendation 2021. There has been very significant changes, and the most important of them is shifting from the primary from cytology as the primary screening test to the HPV DNA testing as the primary screening test. Now, this is a very important slide because there is a lack of knowledge because in many healthcare professionals are not updated about this new recommendation. For the general population, the WHO now recommends that we can either use a screen and treat policy or a screen, triage, and treat policy. Already, they have recommended to shift from cytology to HPV DNA as the primary screening test, and they have increased the age of starting the screening from 25 years to 30 years. Please follow the pointer. So now we start screening for cervical cancer from the age of 30 years. And also the duration of screening interval is increased from previously, which used to be 3 years till 49 years, and 5 years from 50 years onwards. This has now been increased to 5 to 10 years. There is a certain deviation for the women who are living with HIV, because we have already seen that those who are infected with HIV are at increased risk of getting HPV infection and in turn cervical cancer. So for them, we follow screen, triage, and treat policy only. HPV DNA is also used as a primary screening test here also, but here we start screening early at an age of 25 years. And the screening interval is also reduced in contrast to 5 to 10 years from the other women. Women with HIV need to get their screening done every 3 to 5 years. There is also a recent guideline, National Health Service Cervical Screening Program 2020, which is the UK guideline. They also have shifted from cytology to HPV DNA as the primary testing, but they have retained the age and the duration of interval as the previous one. That is 25 to 49 years screen every 3 yearly, and 50 to 65 years screen every 5 yearly. If the HPV DNA comes out to be positive, then we need to follow it with the cytology. So since Pap tests are the most common screening test available worldwide and also in India, we should have a basic knowledge about what is a Pap test. This is a very simple OPD procedure, outpatient procedure, which can be carried out in the clinic. The test collects the cells from the surface of the cervix and looks for these cells are then subjected to microscopic examination, and any abnormal cells are looked for. These abnormal cells can be treated even before the cervical cancer develops. And even if the Pap smear is done at a later stage and the woman have never had a Pap smear and comes later in her life and already she has a cancer, it can detect cancer at a very early stage before she has any symptoms. And so at that stage, the cancer is much easier to treat when compared to if the woman presents at a later stage of cancer when she already has symptoms and the cancer has already spread to other parts of the body. So you might ask that if I feel fine, why do I need to do a Pap test? So we need to understand that Pap, whether it is a Pap test or a liquid-based cytology or a HPV DNA testing, these are all screening tests. And the very fundamental criteria of a screening test is to pick up the disease from those who are not having any symptom of the disease. That is from an apparently healthy-looking population. So a Pap test can find treatable changes of the cervix before you have a symptom or before you notice any problem. So this is the right time where you can detect the disease and you can kill it then and there only. Once the problem is symptomatic, we all know it is harder to treat. So I often get patients in my clinic who say that, ma'am, I have done this Pap test some 5 years or 6 years back. So why do I need to get it tested again? The report was normal. So we need to keep it in mind that the test is a screening test and not a diagnostic one. So there are some false positive, there are some false negative in every screening test. Fortunately, the false negatives in Pap smear is very less, but nevertheless, we need to get it repeated at the recommended duration. Also, since the test is repeated based on the local recommendation, whatever are being followed from about 3 years to 10 years, new changes may occur since the last test. Also, it may take many years for changes to develop or to be detected, so that when you had your previous test, there might be some very subtle changes which were not detected at that point of time, and those have progressed over years, and now it has become detected. And also, as we have discussed earlier, that those whose partners have multiple sexual partners are also at increased risk of having the infection. So your risk of acquiring the infection changes if you have new partners. So you need to keep on getting tested at the recommended duration. So what is the best time during the menstrual cycle to have a Pap smear? The best time to have a Pap smear is in the middle of the cycle, and it is best to abstain from intercourse to avoid use of tampons or douches for 2 days before your Pap test. So the basic idea behind all this thing is that you should not be having any sort of uterine or cervical or vaginal bleeding at the time you get tested with the Pap smear, because the results might come aberrant. So what I follow generally in my clinic is that I advise patients to come after 5 to 6 days of after having their bleeding stopped from the menses, and then we are sure that there is no bleeding and we can carry out the Pap test very well. Does an abnormal Pap test result mean that the patient has cancer? No, it's a big no. There are many kinds of abnormalities that can be detected during at the Pap test. It can just be an infection, it can just be an inflammation, it can be a precancerous lesion, which are also divided into various stages like cervical intraepithelial neoplasia 1, 2, or 3. So there are various stages where the infection can be detected, and the treatment is decided according to the stage or according to the level of the abnormality which has been detected in the Pap smear. Now, coming to the effectiveness of the Pap smear, every 2 out of 3 women with who are tested positive with the Pap test actually do not have a disease. They just have a HPV infection. As we have seen, every 4 out of 5 people will have an infection. It's just that they are having a transient HPV infection, which is detected during the test. So we just need to, if someone is tested positive, we just need to give them a course of antibiotic and we just need to follow up them with a repeat Pap smear to see that the infection has got rid of. It is very important that if the test is negative, then most certainly the woman is not having the disease. So this is of great assurance that if the Pap test is negative, we can be assure the patient that you are not having disease, at least at this point of time. But it is also important to inform them that even after a normal Pap test, it is still important to report any symptom of abnormal vaginal bleeding, discharge, or pain to the doctor if they experience any such thing. So some women might have undergone a hysterectomy for whatever reasons. So if such a patient comes and asks whether I need to do a Pap test even after I have had a hysterectomy, so what should be the guidance for the patient? It depends on the indication for which hysterectomy, that is the removal of the uterus, has been done. If that was done for a non-cancerous disease, say for example, someone was having a fibroid uterus, or someone was having maybe an adenomyosis, or maybe someone had a PPH for which they had to have their uterus removed. So in that cases, if the woman was up to date with their previous Pap test and the reports were negative, they need not undergo Pap test any further. But if the hysterectomy was done for a precancerous or the cancerous lesion of the cervix, then you may need a Pap test, and that will be decided by your doctor depending upon how much the disease was spread at the time of operation, what was the stage, how much clearance was done at the time of infection, what was the at the time of operation, and what was the histopathology. Now, this is a very important entity, a subtotal hysterectomy, where we remove the uterus, but we keep the cervix inside the body of the woman. So, in that case, if someone has had a subtotal hysterectomy where the cervix was left in place, then they need to undergo Pap testing, because cervix, which is actually the place of the disease, the cervical screening we are doing with the Pap test. So, as long as the cervix is there inside the body, we need to do the Pap test. Now, the cytology, which we have discussed earlier, the cytology can be done according by two methods: the Pap test and the liquid-based cytology. This is this is just an advanced version of Pap smear, where the cervical swab is placed in a container instead of being smeared on the slide. So this is an instrument known as a cytobrush. We collect the material or the cells from the cervix with the help of this cytobrush, and we just dip the cytobrush in this container containing the solution, and we just rotate it in the clockwise manner so that all the cells are directly transferred to the fluid or the solution. So this ensures that none of the cells are lost from transfer from the eye spatula to the smear. Now we have seen that the WHO and the NHS RCOG recommendation, they have shifted from cervical cytology as the primary test to the HPV DNA testing. So what is HPV DNA testing? This is now the preferred method rather than the visual inspection with acetic acid or the cytology, according to both WHO and NHS cervical screening program. It detects the high risk strains of human papilloma virus, which cause almost all cervical cancers. Unlike the test which rely on the visual inspection, HPV DNA testing is an objective diagnosis. That means if the HPV DNA is present, it is present. If it is absent, it is absent. So there is no space for interpersonal or intrapersonal variation of the result, and there is no place for misinterpretation of the results. And the cells are collected in exactly the similar fashion like that of a Pap smear. But HPV DNA testing is a simpler, much more cost-effective method of screening. It prevents more precancers and cancers, and it saves more lives than visual inspection or cytology. So whatever screening test is in place at your healthcare facility. I would like to tell that in India, still Pap smear are the basic screening tools. Many of the facilities now also have liquid-based cytology, But HPV DNA testing is at present available only at few centers. So we still rely on the Pap smear and the liquid-based cytology for cervical screening. But nevertheless, whatever is the screening method used, is it a compulsory test for every woman to undergo, or is it a woman's own personal choice? So, like any screening protocol, it's a woman's own choice whether she want to undergo cervical screening or not, and she can always opt out from screening. But we should inform them, and we should provide them with proper knowledge that cervical screening is one of the best ways to protect you from cervical cancer. So I hope after till here, at least the beautiful delegates present out here will definitely talk to their gynecologist and will undergo a Pap test or a cervical screening as soon as possible. Okay.
Yes, ma'am. Thank you. You're sharing your knowledge with us. Thank you, ma'am. Thank you.
So if all the delegates present here at least undergo screening, then the seminar or the webinar will be a fruitful one.
Yes.
So till now, we have discussed about detecting the disease at an early stage, but how about preventing the infection at the first place? So we all know that prevention is always better than cure, and we have got an effective tool for preventing the HPV infection from occurring, and that is the HPV vaccination. The important HPV serotypes, which are in positive agents for most of the cancers and most of the genital warts, are HPV 16 and 18, which are the high risk HPV, causing 70% of all cervical cancer, and HPV 6 and 11, which are the low risk HPV, which are responsible for about 90% of all the genital warts. We have got two types of HPV vaccines, Gardasil and the Gardasil 9. Gardasil contains 4 serotypes, 16 and 18, which are the high risk causing the cervical cancer, and type 6 and 11, which are the low risk causing genital warts. And Gardasil 9, which are apart from all the previous 4, that is 16, 18, 6, and 11. Gardasil 9 also covers certain other types, 5 other types, 31, 33, 45, 52, and 58. And both the vaccines are supplied as a liquid in a single dose vial or a syringe. So anyone who can see this slide, he will say that obviously Gardasil 9 is a better choice to opt for, because this provides protection against 9 types in comparison to the Gardasil, which provides protection against 4 types. So why do we still need to have Gardasil? Why would one rather go for Gardasil? So like there is a major limitation here, which is the cost. There is a huge difference in the cost of the two vaccines. Gardasil comes with an MRP of about 3,900 something, which is about 4,000 per dose. Whereas Gardasil 9 costs about 10,850 per dose. So there is a huge difference in the cost of the two. Where money is not a problem or cost is not an issue, or the patient can afford, Gardasil 9 is obviously a better choice to go for. But where cost is an issue, we should always offer Gardasil, because something is always better than nothing. And the major positive type 16, 18, 6, and 11 are covered in Gardasil also. So if a patient cannot afford Gardasil 9, you should not miss the opportunity to get yourself vaccinated with Gardasil at least. Talking about the efficacy of the vaccine, the HPV vaccine prevents 70% of the cervical cancer and 90% of the genital warts. And chances of getting cervical cancer decreases significantly if the vaccine is taken before the initial sexual contact. So it is very important that we spread information about HPV vaccine to the young girls and to their parents. And one important platform can be by conducting some webinars or seminars or a health education talk in the school, so that we can at least offer this vaccine to the young girls before they have had their first sexual contact, because the benefit of the vaccine declines with the increased HPV exposure. The target population for HPV vaccination is 9 to 14 years of age, both girls and boys. So obviously the boys cannot have cervical cancer, but the Gardasil 9 also Gardasil 9 also prevents against genital warts. So boys are also included, should also be included in the target population. From 15 to 26 years of age, we can still vaccinate the girls and the boys who have not had received any vaccine when they were younger. So it's never too late. Yeah, best is to vaccinate between 9 to 14 years, but nevertheless, we can use the opportunity to vaccinate them between 15 to 26. From 26 to from 27 to 45 years, FDA does not approve a vaccination. The decision can be taken by the discussion between the doctor and the patient. So what is the regime? From 9 to 14 years of age, both boys and girls need to get vaccinated with 2 doses of the vaccine, where the second dose has to be given 6 to 12 months after the first dose. If for any reasons they are not vaccinated up to 14 years, we can still vaccinate them from 15 to 26 years of age, both boys and girls, but they need 3 doses instead of 2 doses at 0, 2, and 6 months. From 27 to 45 years, if after discussion between the doctor and the patient, they have decided to go for the vaccination, we have to give them 3 doses at 0, 2, and 6 months. And more than 45 years, vaccination is no longer recommended. So is the HPV vaccine safe? Yes, HPV vaccine was studied in tens of thousands of people around the world, and no serious safety concerns have been reported till now. The common side effects include like that of any other vaccination, like a sore arm for a day or two after the vaccine shot, or a mild headache, or a low-grade fever, which usually tends to settle by itself. The vaccine should not, this is very important to note that the vaccine should not be taken if you are pregnant or if you are trying to get pregnant. HPV vaccine and cervical cancer screening. So if someone has got the HPV vaccination, the full dose, the 2-dose regime or the 3-dose regime as per age, does this population also need to go for cervical cancer screening? Yes, they have to go for the screening as usual. Cervical cancer screening recommendation should not change for females who have received HPV vaccination, and the smear should be taken as usual, because the HPV vaccine does not work to eliminate the current HPV infection. If the person is already infected with HPV, the vaccine cannot cure that infection. It cannot eliminate that infection from the body. It can only prevent certain types of HPV infection from from a person from acquiring certain type of HPV infection, not to eliminate those infections from one's body. And what is the duration of protection or any booster dose recommended? The protection from HPV vaccine is expected to be long lasting, and no additional booster doses are recommended as of now. So even after getting HPV vaccination, or even if you are following your cervical cancer screening program protocol on time and getting the test repeated every scheduled interval, you should report to your doctor for any of the following symptoms. If you are experiencing any abnormal bleeding between the periods, after intercourse, or after menopause, you are having any unusual kind of vaginal discharge, or any other symptoms like leg pain, pelvic pain, changes in the bowel or bladder habits, bleeding from rectum or bladder, which can indicate advanced disease, you must immediately report to your doctor. So I would like to conclude the discussion from my part here. With that, as a healthcare professional, it is our duty to increase the awareness about the cervical cancer in females from a very early age, to educate and encourage them about HPV vaccination, and to ensure all the women get their regular cervical cancer screening test in line with the recommendations. Thank you.
Thank you, ma'am. Thank you so much. It's very informative. and I promised to do my screening definitely after this, because I was unaware of this actually. And I will also let my fellow mates, whoever are nearby, women of this age group, I'll surely promise to tell them about this. And it was very informative, ma'am.
Here is lies the magnitude of the unawareness of the disease and unawareness of the
Yes.
simple basic test we are having, and this is a
Yes.
very basic test, and a little discomfort one might notice during the test while getting the Pap test done, but this is very similar to like any other gynecological examination. So this little step can prevent someone's life. So we really need to spread the word, and we really need to educate everyone around us.
Sure, ma'am. Sure. I have a few questions. Like, ma'am, one question I have.
Yes, please.
Yeah. Is it fatal, ma'am? If suppose it's in the last stage, it's diagnosed to be cervical cancer, is it fatal, ma'am?
Yes, any kind of cancer, if it is diagnosed in the last stage, see, the last stage is a layman term which we use for the very advanced malignancy, which means that the cancer cells has already spread to the different parts of the body. So for cervical cancer, the last stage might mean that the cancer has already spread to the lungs, to the liver, to other vital organs. So it's practically impossible to take out to the normal cells from every part of the body. And so definitely we are left with, we don't have much to do for those patients at that point of time.
Right, ma'am. Okay, ma'am. Thank you. Any more questions? I don't think.
If anyone has any other doubt, I will be more than happy to clear that.
No, ma'am.
Hello. Ma'am, one more thing, like how do we make people, young girls in the village areas to be aware of it? Like how do we, is there any test available there which can be done there, like
so
remote places?
Pap test is a very basic test, and we can train even the ASHA workers or the Anganwadi workers to perform this Pap test, to collect the material for this Pap test. It really takes 3 days to maximum of a week of training for them to collect the test. So we just need to spread the knowledge about this. We just need to make them aware that they need the women who are coming to the gynecological OPD for any reason, maybe they don't have any symptom related to cervical cancer, but we need to provide them knowledge that this test is in place. Why do they need to get it tested? And even Pap smear are being done free of cost in certain government facilities also. So we should never miss an opportunity to use that.
Okay. Sure, ma'am. Thank you so much. Priyanka, over to you, Dr. Priyanka.
Yes, thank you. Hello. Thank you for sharing your knowledge. Thank you very much, ma'am.
Thank you, Dr. Priyanka.
Yes.
Thank you, IAP, for providing me a platform so that I can at least do my bit to increase the knowledge and share the information with the common people.
Thank you. Thank you. We are well.
Thank you, ma'am. Thank you.
Fortunate.
Okay, it was a very nice session. I like to thank Dr. Saboo ma'am and the West Bengal team for conducting such a nice webinar. Yeah, on behalf of the IIP Digital team, I'd like to sign off. We'll end the session now. All right.
Thank you.
Thank you, everyone.
Thank
Thank
you,
you so
ma'am.
much.
Thank you.